what else you do here in your practice. What other types of things would people come to see you for here at your practice?
I specialize mostly in bioidentical hormones. So most people call them the natural hormone replacement therapy. It's mostly made popular by Suzanne Summers. And she does a whole rhythm of cyclical dosing. And the main thing that we do here is we look at people's hormone levels through blood. And then we say, based on those hormone levels and symptoms, after we do a nice history intake, what specific hormones should they be on and what dosing they should be on. It helps with simple things like hot flashes, night sweats, mental acuity. Definitely helps with things like digestive disorders as well, building bone. People wouldn't think hormones do the amount of things that they do, but really they're fundamental for our bodies.
You know, it's so true, and I find that people at my age, I am 47, I hate to say that, just turned 47. You know, we're starting to really experience a lot of these symptoms that you're talking about. I mean, I am getting migraines all the time. I've had friends with the hot flashes. You know, I haven't experienced that myself. I know everybody has sort of a different experience. You know, definitely a reassessing of who we are and where we are. And I think the symptoms really force you to look at yourself in a whole new light. And I know you treat the whole person here, not just specifically a hot flash or a migraine. So I think that that's important for people to know that really are in need of some help with their hormones. You know, coming here and having Dr. Austin look at you as a whole person is really important, and I think extremely helpful in knowing we can get bioidentical hormones to help us through a certain phase in our life.
Exactly, and it's a different way of looking at your overall picture of health. It's not just a matter of taking one hormone every single day, which a lot of doctors prescribe natural hormone replacement therapy, like with a patch, the Vivell dot. We're talking about matching your own body's rhythms and how it releases estrogen and progesterone. They're different. So we don't take estrogen the same dose every single day because our bodies don't have estrogen the exact same dose in every single day. So what we do here is the cyclical dosing, so it matches your own body's levels back when you're 20 or 30 years old. So we're talking about optimal health, not just treating a hot flash like you mentioned, but actually getting people to function the best way that they can and be the best person that they can be.
And you start that just with blood work. That's kind of the beginning. You take the case and then you do blood work.
Exactly. And then from there, after we find out everything that's going on, we will dose the hormones to them, estrogen, progesterone, or testosterone.
And how often do you need to follow up with a person?
We usually do the first year, we follow up every 3 months, and we do blood work every 3 months because it takes about 3 months for your body to make the full amount of receptors to pick up the hormones. So it gets quite complicated and scientific, but every 3 months is kind of where we tend to follow.
So you would come here and after 3 months, we hopefully will be feeling a little bit better, and then we're kind of on the road and you can track us.
That's it.
For a year or so.
And then after a year on it, you're smooth sailing. But every 3 months, we tend to need to adjust something. And it's individualized protocols. So not everybody's on the same dose and not everyone has the same rhythm. So we have to work with the people and they have to chart everything that they're doing. And we can say, if you're still having a concern or bloating at this point in the month when you're on progesterone, then we need you to lower the dose or increase the dose. So on certain days. So it's really, as most of an individual protocol you're ever going to get.
Okay.
It's good.
Well, that's great. Well, thanks so much for talking with me today. I really appreciate it. And all of Dr. Austin's information, again, will be on theflyingnest.com. Thanks so much.